Hey, welcome to another episode of Clear Lake Connections, where we talk to the people behind the businesses. Bay Area Houston, proudly sponsored by UTMB Health. And today's guest is Maria Patawaran, and you are here to talk to us about the Regional Women's Services and Pediatrics network that you're working with.
Yes, sir.
Tell us about it.
The Regional Women's Services and Pediatrics is actually probably the most extensive community outreach program of the University of Texas Medical Branch. The goal of it is to really provide underserved women and children across Texas. We have clinics from east, southeast, and some parts of South Texas. We have 32 clinics. 12 of those clinics are full-service pediatrics and women's services that provides prenatal care, preconceptual counseling, testing for sexually transmitted diseases, and a lot of gamut, including dysplasia services, diagnosis of cervical cancer and breast cancer, and then we have assistance program that helps the women, and pediatric services as well. The one good thing about this program is 30% of our funding source actually comes from grant programs.
Okay.
So we have services for people who might not otherwise receive care. So we are very fortunate and proud of these. As UTMB celebrated 130 years of service to the community, the regional program, or the Regional Women's Services in Pediatrics, has been more than in service for more than 30 years.
Okay. Yeah, and I was looking at the website, and you do have a nice coverage area here locally. So how did you get involved with this?
Well, I have been with UTMB for about 27 years. By trade, I started as a registered nurse, and I'm homegrown. It's a university, so I went to school at UTMB, grew up in my, in my hole, and, pretty much, bloom where I was planted, and then, kept on going. Leadership touched me after I finished my doctorate, and during that time, I was also diagnosed with breast cancer. So around that time, the leader of UTMB, Regional Women's Services and Pediatrics, was transferring to a different position. And after I sat down in treatment centers and things like that, the program was endangered because the leader was leaving. So, but because, cancer had touched me, I realized that there was such a need in the community for this, and the program cannot be discontinued or cannot be given to people who are not well-meaning. So, with my eyes closed and with a lot of caffeine and support from my family, I jumped in, and here we are. And during that time, the program was endangered of getting less funding. And from that to now, we are being offered by the state 30% more from what we were traditionally have offered of about $8.5 million. So now we're getting 30% more of that. And we could serve more, and give more to the public at the same time, support the women and children around us.
So it's a proven model, and the state is willing at that point to, if this works, we're going to keep funding it.
It is normally a performance-based industry. If you don't produce, you don't get it back. In other words, if you don't use it, you will lose it. So I had mentioned the 12 clinics that we have for women and children. I said 32, that serves 28 counties. 19 of those are nutritional programs. I'm sure that a lot of you guys have heard about the WIC program. A lot of our clinics are co-located with a WIC facility, which the Women, Infants, and Children program that provides nutrition. It's basically a one-stop shop for the mom. So she gets, she gets care from us, and then she goes over to the other side and gets, nourishment for that child. So we can have kind of like a full service for that mother.
Yeah. And so it's such a positive model because, like you said, it's one stop for both the mom and the child, and then you're also meeting some extra needs that might not be being met.
Not just that, we also have 2 services that comes with a service. In the event that the mother needs financial screening and needs financial help lower than the federal poverty level, they can actually get screened in the clinic, get seen on the same day, and at the same time get connected to WIC all in one day. So, for people who are actually, day workers who are, if they don't work, they're not going to get paid. It's a service that's great. Another good thing about the program, 4 out of the 12 clinics actually has we call it the cheer room, which is when our patients come, they may not have child care at home. We have places wherein there's a child care worker, the child of the mother who's there for pregnancy care, goes to that room. The child gets educated with brushing your teeth, oral hygiene, hand washing, and then the mother gets the care for her newborn baby that's inside. Mm-hmm. So it becomes like a family affair almost.
So you've obviously been with UTMB for a long time.
Yes.
It seems like this commitment to the entire person and the health of the entire person. When do you feel that started taking hold and becoming kind of a part of what UTMB Health does?
Well, UTMB has a 3-pronged mission. Okay, we promote not only stellar best care. We also provide research and education. That has to come from the people that works within, right? And the mission and vision of the Regional Women's Services in Pediatrics actually encompasses all of those. In fact, most of the people that works within the regional program actually were homegrown from the programs of the education. And this is the truth, we even have patients that were our patients and then now works with us in the facility. Why? Because a whole lot of times people really don't need a handout. They need a hand. So if you cross them over to that hump wherein it was hard for them, they remember you. They remember how you were cared. They were cared for. They were accepted, and that the people inside those clinics actually cared about them.
Yeah, and that's the whole idea of bedside manner has kind of changed over time, and that's to that point.
I still believe that exists in the regional program. Now, I have to say that our patients are not always easy to take care of, right? We have a lot of socioeconomic, issues that we have to deal with. A lot of our patients have, language barriers, and we do provide all of that too. We have people who are on site that actually speaks other languages. It is one of the talents that we do provide our clientele. But at the same time, even if it's not the common languages that we speak, we actually have language assistance that's available by phone. And that is actually something that's just usual, when you come to the regional program. And depending on where your location is, you may have a different population.
Yeah.
For instance, Pasadena and Pearland may have a little bit more Hispanic, but when you go over to Sugar Land and Decatur, you may have a different population endemic in that area.
Yeah, it's amazing. It's the most diverse region in America, and it sounds like you guys are really taking that into account and trying to address that.
Another thing too is that when we build our clinics, we actually build it in partnership with the communities that we are actually building it on. We don't come in and take whatever is they have a lot of already. What we do is we communicate with the partnerships that's already existing. Let's say for the chamber, we also talk to the judges and we discuss what are the needs of your community. What is geomapping mean to you? Will we be able to help? And we try not to, in other words, we address the needs of what really is appropriate.
Yeah, make it a true partnership,
exactly.
A collaboration. Now, one of the things that struck me when I was on the website was midwives. Are they making a comeback?
They never disappeared, actually. We have part of the services of the Regional Women's Services in Pediatrics is that we can take care of the woman from the womb to the tube, right? And, and we also can take care of them from the least complicated to the most complicated. In fact, a lot of our referrals or a lot of the people who deliver at UTMB sometimes self-select UTMB because of the extensive high-risk maternal fetal care that we can provide. But we can also take care of the certified nurse midwife group that does not want a whole lot of intervention, would really like to have an all-natural, with very minimal, intervention allowed, as long as it's reasonable. Our CNMs or our certified nurse midwife service will actually accommodate as much as they can, as long as it's within reason, and that we can safely deliver care to the woman and to the child.
Yeah, it just struck me because my mom was a midwife back in England.
Awesome.
And my brother was born at home in Holland, and it just seems like we've kind of overcomplicated something that's been going on since the beginning of time. And it's nice to see that, like you said, if it's a simple and straightforward, that people are taking advantage of that.
I have to say that, as a provider, because I am still a practicing nurse practitioner up to today, and that's one of the strengths of the program. Our leadership are actually, practicing people. Like, we never get out of practice, so that's why we never forget that, there is. We understand, what's happening on boots on the ground. Mm-hmm. So I will say that, that's one of the beautiful things about this is that we can touch the client exactly what their needs are. And our hospital is such as that too. The certified nurse midwife is in one room with nothing, with just breathing exercises, doing what they need to do. And then if something happens, across the hallway is actually, we have from an obstetrician to as high as a neonatologist and as a maternal fetal medicine physician. We're trying to provide the best care, most evidence-based that anywhere in the country, can we can speak of.
It's refreshing to hear because you're giving the level of care that's best for the patient. But it sounds like it's a great way to control cost, because that's what we all hear about in the media is, the rising cost of healthcare. And so it's refreshing to see people trying to line that back up and basically help people out financially in that case.
Absolutely. That's what the regional program tried to give. We try to give the most cost-effective, safe, quality, value-based care that we can provide.
Yeah, and it sounds like you're doing it on a daily basis, and it sounds like you've got your hands in it too.
Yes, absolutely. We try.
You've been with UTMB 27 years. What is it about the culture of UTMB that you love so much and has kind of kept you energized and going the whole time?
I'm a perennial student. I like to learn, and when there is still something to learn, or I need to in a university setting like UTMB, that somebody's always smarter than you are. You look around and right now I'm working with all sorts of people. I work with the Gen Zs, with the millennials, with the every gamut of culture or culture fit, and you have to try to grow with it. It's like growing with your children almost, and that's certainly what attracted me to UTMB, and that's why I still keep on coming back to work as well. Every morning is it's a great day at the university because there's always an inquisitive learner that's there who would like to get their hands dirty and something, and somehow with my position right now, I feel like I'm also giving back. Not only to the patients, not only to their families. I came here as a migrant worker. But I've been in the United States longer than I've lived in my own country, and I have seen the division. It doesn't only exist in people far away. It actually exists here, right where I live. So because of that, I may not be able to do it, for the whole entire world, but at least I could do it in this little portion of the clinics that we live in. Mm-hmm.
So how do people get in touch with your network?
We are part of UTMB. So if you go into the UTMB website, you'll find us. If you go into each clinic has a Facebook page. If you're looking to do that, you can find us as Google. We're actually in Google. You could type any kind of keyword, and we will come out. We have some advertisements now that you can find in area places that are commonly reached by women. I know you've heard about the women as the caretaker of the family. That's how they find us. If they're at the mall, they can see our names. Hopefully, then they can find that way. Also, too, if you are pregnant, we do provide tours to the island, and the tours are we scan our code. You can go into any of our clinics. If you have been to us, then we will find you that way. If you've never been to us and you just want to look at our facility, you're welcome to do that too. That is an open
kind of
service.
A try before you buy type situation.
Absolutely. If you see the place.
Excellent.
Now I have to say that one of the things we're very, very proud of right now is we had received an $8.5 million refresh for all of our clinics, and one of the clinics that we are very proud of right now is our Texas City Dickinson Joint Clinic. That is now very beautiful, and because of the money invested with us by UTMB, we are not only technologically savvy now in each one of our clinic that could be like anywhere that you can be. It also provides our staff for a better working environment and our patients to get the most technologically advanced things. Like we have compliant ADA beds now in almost all of our facility because it's all new. We also have machines that communicate with our EMR system, our electronic medical record system, that makes it seamless, to have activities that will communicate anywhere around the university.
Yeah. So what would be your hopes and aspirations for the program that to see it grow and kind of manage that? What would that look like?
My goal for the program is not just to maintain, because I think we're good at maintaining. What I want is to continue to improve, to continue to be able to serve, and to extend some more, because I do think that we're with a lot more funding and with a lot of support and with very, very well-meaning people who are invested and who loves to do this, we could make this grow. And honestly, like I said, our patients, if you ask about us, most of the time our people are return customers. This is probably one of the rare opportunities that we actually have some sort of marketing ongoing. Most of our services are by word of mouth. It's from mothers that already had babies, and then now they're grandmothers, and now they're having babies. And because existing for 32 years, I have to say maybe we're doing something right, and that's why they keep on coming back.
It sounds like it for sure. Yeah. Well, I want to thank you for coming out and appreciate the work you're doing.
The pleasure was ours.
Thank you.